resort.
Meanwhile, Adam Gilchrist has given an update on his former teammate Damien Martyn, saying he's showing encouraging signs after being hospitalised with meningitis. Martyn was placed in an induced coma after being rushed to a Queensland hospital on Boxing Day. For more details on meningitis and what to look out for, I'm joined by Dr. Linny Fong. So, first of all, this is obviously a terrible, story, and our thoughts go out to Mr. Martyn and his family. But can you explain to us what is meningitis, first of all?
Absolutely, yeah. So, obviously sending positive thoughts to the family, because obviously it's a very stressful time. So meningitis really is, it's basically a term that describes many conditions, but essentially is where the brain and the spinal cord are covered by a protective layer called the meninges, and that becomes inflamed, and that can be due to a number of different reasons. The reason why that's important is because the brain is kind of encased in a rigid, bony skull, and so any changes in pressure due to swelling or inflammation can cause an effect on the brain and therefore affect the vital functions of the brain. The fact that, we've read that he's been in an induced coma, so we know that we do this for protective reasons. So often what happens is by putting someone into a coma, we're essentially reducing brain activity to allow time for the doctors to be able to work on what's causing the swelling, to bring that down, perhaps to treat an infection that might be causing the swelling. Ultimately the aim is to reduce the pressure, but also to reduce any further injury to the brain.
So meningitis, it's not a virus as such, but it can be caused by other viruses. Is that right?
Yeah, it can actually be caused by quite a few things. So it can be caused by, there's infectious causes and then there's non-infectious causes. So infections include viruses, also bacteria. Rarer causes are parasites and some of the fungal infections as well, and that occurs in people with compromised immune systems. But certainly what we see is with viral meningitis, that is the most common. Generally that is less severe, but bacterial meningitis we know is quite severe, can make people really, really sick, and is definitely a medical emergency. We don't know what's caused Damien's condition at this stage, but certainly sounds like he's in quite a serious condition.
Yeah. And what kind of symptoms do you see when someone does have meningitis? Yeah,
so because of where it is and I guess the effects, what we often see with all sort of meningitis, regardless of the cause, so it can cause fever. Often we think about fever associated with a severe headache, neck stiffness, and then nausea or vomiting. In severe cases, it can cause drowsiness and confusion. And then in babies, which are sort of my paediatric population that I see, can be really non-specific. They can be really irritable, they can go off with their feeding, and they can have a high-pitched cry. There are some instances of meningitis as well when they are associated with certain bacteria, where we think about a rash, which is non-blanching, so when you put pressure on the rash that it doesn't go away. So that again is kind of a red flag for a medical emergency.
But a lot of those symptoms, people would kind of dismiss it as just being something else, right? They wouldn't know how serious it is. That must be really difficult then.
Yeah, definitely. And I think that's the thing. I think, in terms of this story, and, we know that meningitis is absolutely quite rare, but what we, as doctors want people to know is that just to really look out for those red flags. So if you are suspicious of meningitis, this really severe headache with a fever, that neck stiffness, that sensitivity to light as well, then that is your sign to go and present for medical attention, because if it is something like bacterial meningitis, we need to get the antibiotics into you straight away. Think about intensive care, surgery, and all those sort of measures to make sure that we get a good outcome.
And is there any way to prevent it?
Yeah, it's a really good question. So depending on the cause, so when we think about bacterial meningitis, there are preventative measures, so there are vaccines that are available, and a lot of people probably don't realise that on the National Childhood Vaccine Schedule there are 3 bacteria that we target towards sort of meningitis. So there's meningococcus, there's pneumococcus, and there's Haemophilus influenzae type B. They have dramatically reduced the number of cases that we've seen in Australia, but certainly in terms of kind of overall meningitis, it's really about, again, being aware of signs and symptoms and presenting for care so that it is timely and we prevent complications.
Linny, thanks for coming in and explaining it, because I know when a lot of people heard about Damien Martyn, the questions also were, well, what exactly is meningitis? Thank you very much for coming in.
Thank you. Thanks for having me.
And of course, just to reiterate, we absolutely wish Damien Martyn all the very best in his treatment and recovery as well. Okay, let's bring you up to date